This week marks the National Child Protection Week, which is commemorated in the country annually to raise awareness of the rights of children as articulated in the Constitution of the Republic of South Africa and the Children's Act, the Act number 38 of 2005. Now, the week will be commemorated under the theme, Let Us Protect Children during COVID-19 and beyond. Now, let's discuss this further. We're now joined via Zoom by Marguerite Holtzhausen, Executive Director at the Trauma Center for Survivors of Violence and Torture. Thank you so much for your time this afternoon. Now, let's look at just some of the stats around, crime around kids and children. Between July 2021 and June of 2022, there were 1,188 children murdered in South Africa, and those are reported cases. Now, just looking at those numbers, would you say campaigns such as the National Child Protection Week are working?
Yes, we can use it and it can be useful, but we can't just have success from 1 week. We need adequate services 365 days of the year, and we need follow through in terms of providing child protection services. Obviously, there must be a political will to invest in the well-being of children and in child protection services. The Trauma Center is part of an alliance of 11 NGOs in the Western Cape that also campaign for better services, better support towards NGOs who deliver these services. And the problem is NGOs are struggling to keep their doors open. And who in the end is going to fall through the cracks is the children and the families. So yes, we have a week, we talk about issues, but is there a budget that goes behind the words that says, let's protect the children? That is a question that we must ask ourselves as South Africans. Do we really value the lives of children? Mandela used to say that you can judge a society's soul by how they treat their children. And if you look at, as you said, Unati, the stats, it shows that there's a lot to be done to protect children. I asked myself, those 1,188 children, how many of those deaths could have been prevented if there were adequate protection services for children?
So Marguerite, you work specifically, with children that have been exposed to trauma and are survivors of violence. Just what is the impact of trauma on learning and behavior for children that you have picked up over the years?
So yes, in our own experience, when we work in schools, we do programs with children in schools, is that those children are really struggling. Sometimes even half of the children we have in a group have suicidal thoughts. Now, if you've experienced trauma, it takes you into those responses that you would call the fight, flight, or fright response. Fight means aggressive behavior. Flight means you withdraw, and freeze is you can actually do nothing. And one of the characteristics of trauma is that what it does to the brain, it takes you out of your thinking brain. So it has a severe impact on the children's ability to learn. And when we look at recently, information came out about the performance of South Africa in terms of literacy in the world, and how embarrassing it was, how low our scores were in terms of literacy in schools. It's also probably also due to the high levels of trauma that is there in our communities, and that children are actually in that survival mode, and that they actually are not able to learn, and because of the high levels of stress and lack of support for them. Yes, so definitely trauma is a big problem in South Africa in communities. So research that's been done in communities like Khayelitsha, 80% of children have been traumatized. In Soweto, close to 90%. So it just shows us that we have to really look at the mental health of children. Because of what will happen with children when they grow up, that just feeds into the intergenerational cycle of violence, and legacy of violence. It just feeds into the violence cycle. And what we really need to do is we really need to care for our children. We really need to give the support to children when they're still young so that they can grow up and thrive as adults and that we can have a more peaceful society.
And I'm glad you mentioned that, because earlier, when we were talking about the statistics around child murders in this country that are, very, they're high, they're extremely high. You talked about the fact that you wonder how many of those children's lives we could have saved as a community. I don't want to jump too quickly into solutions mode, but what can be done to prevent trauma in children, particularly because we are seeing just the effects of it, as you say?
There are often signs, early on signs that you can see there is something wrong in this child's life. This child is vulnerable. And the people working with children, teachers, and wherever children are involved, even neighbors, you will see this child is not in a good space, and you can go and report it. So it's very important that we do early intervention, that when there is concern with the child, that react. Of course, violence prevention in the broad needs for a multidisciplinary approach. Yes, we have to look at fighting crime from the police. We have to give proper education, but we also need to work with our communities. We also need to challenge the ways we deal with conflict. If you look at the murder rate in South Africa, most of the murders are because of interpersonal violence, because of arguments, road rage, those kind of incidences. So the violence and the culture of violence, we need to challenge that. We need to work together with communities, as government, as the non-profit sector, to find solutions to challenge violence in the broad. But we also need to give services to children, because those children become the perpetrators in 10, not even so long, in 5, 6, 7 years, they become the perpetrators. And then everybody is up in arms. Everybody talks about how terrible this person is and how they got to be the way they were. But when that child was young, who supported them? I'm thinking we talk about Thabo Bester. You just spoke to somebody who's involved in the case. He's also been a child. Maybe if he had support services when he was young, he wouldn't have committed all the crimes he did later on in life. That is, most perpetrators had traumatic childhoods, and they didn't get the support they needed when growing up. So we have to break that cycle of violence somewhere. Yes, it's not a one answer solution. It's not to say, okay, let's put more police into the streets, we're going to fight crime. It's not as simple as that. We have to work on all fronts. We have to look at the totality of society, and we have to look at the totality of the lives and the environments of children and respond to that as a collective.
Marguerite,
and work with communities. We often do things for communities. Communities understand their dynamics, and it's really important that we really consult and work hand in hand as partners with communities.
Fantastic. Marguerite, thank you so much for your time this afternoon.
Yes.
Really do appreciate it. Of course, Marguerite works she's the Executive Director of the Trauma Center for Survivors of Violence and Torture. Marguerite Holtzhausen there.